What's up everyone, this is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. For those that are new to the channel, welcome. My name is Dr. Antonio Webb and I'm an orthopedic spine surgeon. In this video today, I'm going to be talking about Dak Prescott's injury. He suffered a pretty serious ankle injury in the game today versus the Giants. I'm going to talk about a little bit about the injury, how we would manage it as a orthopedic surgeon, and kind of my expectation in terms of his return to play. So in the third quarter between the Dallas Cowboys and New York Giants, Dak Prescott had a serious ankle injury. He was being tackled by one of the defensive players and his ankle actually dislocated. So what is an ankle dislocation? Well, the ankle joint is formed by a number of different bones. It's formed by the talus, the tibia, and the fibula. And it's supported by ligaments on the outside of the ankle and the inside of the ankle called the medial side, and also the posterior aspect of the ankle. I don't have a full leg or tibia as well as the fibula or the lateral aspect of the leg, but this is all I have right here. This is a foot model, but one of the bones that articulates or kind of forms the ankle joint is this bone here. This is the talus, and this is the bones in the foot. This is the calcaneus or your heel bone right here. So this talus, the tibia actually sits right on top of this right here, and it, what we call it, articulates with the tibia. So, and then the outside, which is this area over here called the lateral side, this is the medial side. The outside has another bone called the fibula. It's a bone that's commonly broken. I actually saw someone in my clinic this past week who came in with a fracture of that bone. So this talus, as well as the tibia that sits right on top of it, when this dislocates or the bones pop out of place, that is a really serious injury. So when that happens, the tibia and the talus, this bone, the tibia that sits up here, it basically moves out of place. And the way we kind of classify kind of ankle dislocations is basically based off the position of the foot. So if the foot kind of goes posterior and the tibia stays anterior, that's a posterior ankle dislocation. Most ankle dislocations are associated with injuries to the lateral side or the lateral malleolus, the medial side of the ankle, the medial malleolus, or you can have some fractures of the posterior side of the tibia. Those fractures are called trimalleolar ankle fractures. So essentially what Dak Prescott had is an ankle fracture dislocation. It takes a lot of force to dislocate an ankle. The lateral side, as well as the medial side, and the posterior, the anterior, it's surrounded by ligaments which hold it in place so that when we walk, our every walk doesn't cause our ankles to dislocate. I usually see it, or we as orthopedic surgeons usually see it in patients who get into car accidents, or if they have falls from a roof, or if they are playing a sport like Dak Prescott, where you have a 280-pound lineman that's landing on your ankle. It seems like all of the force from the defensive player landed on Dak Prescott's leg, and his ankle kind of went like this here. When that happens, the tibia kind of dislocates, and that's an ankle dislocation. So as an orthopedic surgeon, one of the first things that we do when there is a ankle dislocation, say for instance, I'm in the ER and I'm on call, they call me and say, hey, I have this kid down here or this adult who has an ankle dislocation. I usually get x-rays in the ER to see what's the direction of that dislocation. As we talked about, it can be a posterior dislocation where the foot goes posterior and the tibia goes anterior. It can be a lateral dislocation where the tibia goes medial and the foot joint goes lateral, or it can be a kind of a combination of either. But I usually try to get an x-ray before I just pop an ankle joint back in place. But when you're at a sporting event, when sometimes you may not have x-rays kind of readily available, or it may take a while to reduce the ankle joint, which means get it back in place, well, sometimes we just pop it back in place. And that's probably what happened on the field. I didn't see any video of that, but he did have an air cast on. You just don't want to just pop an ankle joint back in place sometimes where you don't know what type of fracture there is and you don't know kind of the direction of that dislocation. Because as an orthopedic surgeon, what we're trying to do is kind of restore that ankle joint, and you have to recreate the dislocation. And usually on the field, when the players are kind of their adrenaline's rushing, their heart rate is racing, that's the best time to pop it back in place. In the ER, we usually try to give patients sedation or some type of pain medication. And also I do what's called an ankle block. This is essentially where I use a needle, take some medication like lidocaine, and then insert that into the ankle joint to anesthetize the ankle. And that usually helps a lot of patients with pain when we're pulling on the leg to try to get that ankle fracture dislocation reduced. So after we get the ankle into a good position, usually patients feel better. That ankle joint, when it's dislocated or when it's out of place, it puts everything else on stretch. Your ligaments, your nerves, you have blood vessels that run on the inside of the ankle here. Those ligaments, those arteries, those nerves can be injured. So when patients have their ankles reduced, this can be very pain relieving for a lot of patients. So once we get the ankle joints reduced or back into a appropriate position, this is when we get another set of x-rays in the ER to confirm that we have an adequate ankle reduction. Usually after this, we place patients in a splint. It's called an AO splint. And this is a splint to keep the foot kind of dorsiflexed or up in this position here so that it stays in place. A lot of ankle fractures can be unstable, which means once you get the ankle fracture or the ankle dislocation back in place, that can slip out again because it's such an unstable dislocation that that patient will require surgery. So once we confirm that the ankle dislocation is back in place with x-rays, we place the patient in a splint, and then this is when we decide on surgery. Most ankle dislocations will require some form of surgery just because the ankle is unstable. You tore the ligaments that otherwise keeps the ankle in an appropriate position. Well, we need to restore the ankle joint, and we do this in surgery with either plates and a combination of screws. This is one particular plate here. This is called a 1/3 tubular plate. This is a plate that we place on the outside of the ankle or over the lateral malleolus. And then we usually put a couple screws above the fracture and a couple screws below the fracture to anatomically reduce the fracture and get it into its native position. So this little plate here can bend, and in surgery, I usually conform this to the lateral side of the ankle here and then use a drill and put some screws on both sides of the fracture line. Usually on the medial side of the ankle, this is where we place a couple of screws to reduce that fracture. And sometimes in surgery, when the syndesmosis, which is one of the ligaments that's holding that ankle joint stable, when that is disrupted, we usually put screws across the ankle joint, or we can use different types of really strong sutures to deploy that across the ankle joint to restore some stability. So this is a pretty serious injury. Lots of these patients after surgery will go back into a splint, and usually it's about 6 weeks of not placing any weight on their ankle joint just until it heals. Most bones take about 6 to 8 weeks to heal, so you don't want a patient walking on your ankle after we fixed it until the bones kind of fuse together and heal. If a patient is diabetic, usually we double this time that we leave them what's called non-weight bearing, which means they're not placing any weight on that particular extremity. Because being a diabetic causes their bones not to heal properly, They can have wound complications. So any diabetics, we always extend the time that we allow them to place weight on that extremity again. So I would imagine Dak Prescott is not diabetic, so he will most likely be 6 weeks without placing any weight on that extremity. A caveat is if there is an injury to the ankle joint itself, if there's a fracture that extends down into the tibia, we call that a pilon fracture. Well, these fractures require an additional probably 6 weeks of non-weight bearing to that extremity. So that would be probably around 8 weeks or 12 weeks usually before we let patients kind of walk on that leg again. During this time, we usually tell patients to keep their leg elevated to help with the swelling. And also we give them some crutches so they're not placing any weight on that extremity that we just fixed. So Dak Prescott, really bad injury. It's very unfortunate that they were in talks for this big kind of deal that has not been signed yet, but it's very promising to see people like Alex Smith, who is the quarterback for the Redskins, who had a really gruesome ankle injury and got infected. And after almost 693 days, he came back today for his first game as quarterback. He didn't really have a really good game today, but I did speak about his injury, and I'll put that right up here in a previous video. But this is a pretty serious injury for Dak Prescott, and I wish him the best. So ankle dislocation is where your tibia and your talus, this bone here, separates. When that happens, it can cause a lot of pain. You can injure structures that are around the ankle joint, such as the nerve, such as the artery. And what we try to do as orthopedic surgeons is reduce that ankle joint as quickly as possible, take those patients to surgery after getting x-rays, and fix it with metal screws and rods. And after surgery, we place the patients back into a splint, hold it stable, and not let them walk on that extremity for usually about 6 weeks. I hope you guys learned something from this video. Make sure you subscribe. New videos coming every week. We'll see you next time.